name is Dr. Maggie Parker. I am an assistant professor in counseling and human development at the George Washington University. I did this study with Dr. Michelle Honeycutt-Holenbaugh, who is a professor at Texas A&M Corpus Christi, and GWU doctoral student Catherine Kelly. So our research, we were interested in the impact of child-centered play therapy on externalizing and disruptive behaviors. And so we used a meta-analysis to pool different studies to see what or how effective CCPT was when looking at those outcome variables. So our results were interesting. We had 23 studies that we ended up looking at with 904 participants. And we found for externalizing behaviors, when we looked at child-centered play therapy in comparison to no treatment, there was a small but significant effect size. When we looked at CCPT versus an alternative treatment, there was a moderate and significant effect size, indicating that it was moderately effective. When we looked at total behaviors, we found that there was also a moderate effect size, and it was significant. When we looked, however, at aggressive behaviors, that was not significant. It was also a small effect size, which might be because there were only 4 studies that looked directly at aggressive behaviors. I think it was really interesting looking at this, and we don't really know why, that the smaller effect was when looking at no treatment versus having the larger effect when looking at an alternative treatment. And so I think that's really interesting. Something else that came about as we were kind of researching the discussion and exploring was that though you can't necessarily compare effect sizes across studies, our results really aligned with many of the studies on CBT when looking at disruptive behaviors. And so both of us demonstrated moderate effectiveness. And you are welcome to look at the Center for Play Therapy website for more information on this study. Thank you so much for watching. It's been lovely.